Okay, you guys. So I'm in the middle of I was texting someone. So if I get a text and I happen to stop reading for a sec, that's the reason why. Sorry if it's a little dark in here. I'm trying to fix the lighting on here. But anyway, welcome to the Joy of Gay Sex series, you guys. I'm of course Charlie, aka Miss Charlotte. Hopefully this will help a little bit. But so like I said, this subject um is going to be broken down into different videos because it's a pretty long subject and it's about sexually transmitted diseases. So let's see. I guess what I'm going to do is try to do at least 2 of them and then go on to the next video because I don't want to make one video too long because else it's going to take a long time to upload. So, of course, all this information is out of the Joy of Gay Sex series book. And as I said, I am definitely no sex expert in any way. I'm just reading and learning as I go along, as you guys are as well. So don't think in any way that I'm trying to be a sex expert and anything like that. I had actually got a comment on one of my videos. Somebody was talking about I need to get my facts straight. I'm like, excuse me. I'm reading out of a book that has all the facts. So maybe you need to get the facts straight before you start trying to insult people. Thank you. So anyway, this topic is about sexually transmitted diseases, and there's actually a lot of diseases that are new and that have escalated over the past few years that probably aren't in this book, but this book is the most up-to-date book. So definitely the topics that aren't in here, I can always research and put those extra diseases on the video. So let me go ahead and begin. Sex is the spice that makes life exciting. That excitement, however, may come at a price in the form of a sexually transmitted diseases. Whether you're young and still going through your slut phase or are tricking outside a long-term relationship, you may have to pay the piper for all that fun. It would be hard to find a sexually active gay man who's never had to see his physician for an STD, either something pesky such as crabs or more serious as hepatitis. As a gay man, it is essential that you have a basic knowledge of STDs so that you can recognize the symptoms in you and in your sexual partners. If you discover symptoms that may be STD related, it's your responsibility to insist on being given the correct diagnostic test and treatment by your physician. But you have another responsibility, to notify your sex partners about your infection. Not doing so is a sign of childness and hostility. At one time we used to talk about venereal diseases, those that directly affected the genitals, such as gonorrhea and syphilis. The term venereal came from Venus, the Roman goddess of love. But we have a more sophisticated understanding of a disease today, and doctors generally divide them into bacterial, viral, and parasitical, what we call larger critters. We'll follow that classification below. Since AIDS is covered in a different section, we're not going to discuss it here. Which, of course, I'm going to read about that as well, because that's also part of the diseases, of course. But right now, I'm just going to focus on, like, the STDs. Alright, so I'm going to start with bacterial STDs. Bacteria are everywhere in the world around us and are believed to live in the most hostile environment. Beneath the sea at the mid-Atlantic ridge, where hot lava geysers out of the earth at boiling temperatures, under Antarctic ice, within dust molecules in the upper atmosphere, and even inside rock miles deep beneath the earth. Some biologists believe that bacteria constitute the largest and oldest body of life on Earth. It is impossible to avoid bacteria in daily life, and some bacteria are needed by the body to function. In your digestive tract, for example, where they help digest food, bacteria reproduce by themselves, and only a relatively few given their enormous number, are harmful to humans. Your blood generally produces white blood cells to fight off hostile bacterial invaders. Some potent ones, however, gang up and get the upper hand. That's when you get sick. Among the most common sexually transmitted bacteria are, and we're going to start with gonorrhea. Gonorrhea, commonly called the clap after Mother Clap, who ran a bawdy house for homosexual men in Holborn, a section of London. 30 to 40 men a night were entertained there until one day in 1726 she was charged with keeping a sodomitical house. The term homosexual wasn't coined until 1869. The poor lady was fined, pillared, and sentenced to 2 years of hard labor. We don't know if she survived. Clap is a major health problem in gay men. About 15% of men who get gonorrhea in the penis do not develop symptoms, and even those who do not may not see them for 2 weeks. That makes detection difficult. Carriers without symptoms can transmit the disease without knowing it. Therefore, men who practice unsafe sex should have a routine STD checkup every 6 months. Every 3 months if you're still being a slut, which means an anal, penile, and throat smear, and a urinalysis for clap, and a blood test for syphilis while you're at it. A blood test alone will not diagnose gonorrhea. Even if you have regular checkups, you can unwittingly infect an awful lot of people before you discover you have clap. The bacteria perform a warm, moist environment like your cock, rectum, and throat. You can get clap in the cock by getting a blowjob from someone whose mouth is infected, or you can get it in the mouth or throat by sucking someone with an infected dick. Symptoms normally appear between 24 hours and 5 days after exposure. The chief symptoms are a discharge of thick, creamy pus and burning during urination. The pus is produced when bacteria invade the cells that line your urethra, the canal that carries urine. By milking down your cock, you can see the earliest signs of pus. You should also check your underwear. The dry pus will make the pouch of your underwear stiff. Some sexually active gay men never undress with the trick with the lights off. They quietly take down the trick's underwear in the light in a sexy way and check his dick for a discharge. If they find it, the trick goes packing. He shouldn't have sex while he's infectious. This procedure needn't be clinical. Use your imagination. If, however, you delay treatment, the infection will spread up the urethra and into the prostate, which will really fuck you up. You can develop the clap in the ass if someone with gonorrhea fucks you without a condom. Symptoms are usually slower to show up in the rectum, if they develop at all, and detection is certain only if your doctor looks at a smear under a microscope or cultures the bacteria in a laboratory. The symptoms you might notice are rectal fullness, feeling as if you have to crap, pain, frequent farting, rectal bleeding, hemorrhoids, pus, or blood in the stool, diarrhea, constipation, and sometimes an inability to piss. This urinary retention is brought about when bladder nerves are infected by gonorrhea. The symptoms don't necessarily mean you have gonorrhea. Only a test can determine that. But be forewarned, you may not have symptoms at all, or you can have clap in both your cock and your ass. But because you can feel the symptoms in your cock more clearly, you might not notice what's happening in your butt. If your doctor is heterosexual or unfamiliar with gay health problems, get over your shyness and tell him that you need to be regularly tested in the rectum. Don't be retention about asking for an anal smear. Some straight physicians are embarrassed about asking. If your doctor refuses to do an anal smear, walk out. Don't pay the bill and get a new doctor. Gay men also contract gonorrhea in the throat. Symptoms are often absent, but when present are sore throat, cough, respiratory congestion, and other cold-like disturbances. Sometimes the glands under the jaw swell. Clap in the throat are less frequent than clap in the penis and anus, but then again it depends upon your sexual behavior, what you do, and with whom. Gonorrhea should be tested immediately. If it is not tested, the acute symptoms will go away after about 6 months, but the disease may lead to arthritis, pericarditis, inflammation of the sac around the heart, or emphysema. Medical authorities have also learned that men with clap are at increased risk for getting infected and infecting others with HIV. Your physician, of course, must confirm all these suggestions. He alone can prescribe treatment, though you should insist that he take a cure culture after treatment. That means testing you again for the disease to be certain that you're cured. Don't even think about telling your lover, should you infect him, that you picked up the clap or any of the following STDs from kissing an old flame, sitting on a toilet seat at work, using a dirty towel at the gym, or drinking from a greasy water cup. This kind of bacteria needs a constant supply of carbon dioxide and dies seconds after exposure to air. In any event, your boyfriend won't believe your bullshit, and you'll be correctly accused of both tricking and lying. This will cost you at least 10 sessions of couple therapy, lectures about double betrayal, and a bill of particulars about your tawdry behavior going back to childhood. Pony up to your infidelity, take your punishment, and don't lie. Alright, you guys, stay tuned. The next STD we're going to talk about is syphilis. That's on the next video. Holla back.